Welcome to another episode of Bishop's Gambit. Today we're at Long Health and Wellness on North Sharon Amity, meeting Dr. Kashiti Long.
You get same day, next day visits, 30 to 60-minute appointments. In my first visit, I'm asking people, and then some people are like, I just need a doctor that is going to answer the phone.
Whether you're looking for something fun to do or you're curious about how entrepreneurs think, you're in the right place. This is Bishop's Gambit. We meet the people and explore the places that make Charlotte one of a kind. We're talking with locals who are building businesses, creating culture, and shaping the Queen City, one hustle at a time. From hidden gems and neighborhood staples to up-and-coming creators and entrepreneurs, we're going behind the scenes to find out how they got started, what keeps them going, and what success really looks like in Charlotte. It's laid back, it's real, and it's full of the kind of stories you won't find in a brochure. Let's dive into what makes this city tick.
I am Dr. Kashiti Long, the founder of Long Health and Wellness, which is a membership-based primary care practice here in Charlotte, North Carolina. We opened in January and we are accepting new patients. We are membership-based because that helps us focus on the whole person and treat you as more than a number.
So tell us a little bit about what that means. What is membership-based healthcare as opposed to the traditional model? How is that different?
In traditional healthcare, you have maybe 10 to 15 minutes with your doctor. It's usually pretty rushed because it's a volume game. Instead, we use a membership, which means you pay a flat monthly fee, and that covers all of your visits with us. That means you get same day, next day visits, 30 to 60-minute appointments, and a focus on prevention and wellness. And we are able to do that because we do not use the insurance model.
So what do you mean you don't use the insurance model? I think everybody is just expecting they walk in, they pay their copay, whatever it needs to be done up front, and then the insurance handles the rest. So if you don't use insurance, how do people make their payments?
So we do not charge a copay. When you sign up, you opt into monthly invoicing of the membership fee. And so we don't worry about copays or deductibles, in network, out of network, any of those things. If you want to use your insurance, you can use it for labs, for referrals, if you go to the emergency room, things like that. But anything that we do inside the office is covered under your monthly membership fee.
So they have just one monthly predictable payment that there's no surprises in how much it's going to be every month, regardless of how much they need you.
Correct.
That's an interesting idea. And when we first met, I had never heard of this model, and it really intrigued me. And that's why I was so excited to do this interview. So tell me a little bit about your customer interactions. What is it that your customers find memorable about meeting with you, and what it is that your goals are for your customers, your patients, as they come in?
When a patient signs up, they will immediately after you fill in your information, a form will come up for you to schedule your first appointment. The first appointment is an hour long. And usually we use that appointment as a get to know you appointment. So it's not necessarily like a physical or a problem visit. It's okay, what are your goals? What's your history? What are we watching out for? Where do you want to be? And kind of doing some goal setting with the patient. So my goals for the patient are not necessarily primary. It's going to depend on what they want, because some people are just like, most of the people that come here are very health focused, and they're like, I want to avoid pre-diabetes. I want to get off of some of this blood pressure medicine. I, just don't want to be on all the things I see my parents on or something like that. And so we'll like work on those things. And then some people are like, I just need a doctor that is going to answer the phone. So it really just depends on what people need.
And so how do you approach those different aspects? If somebody says they want to get off their blood pressure medicine or something like that, that's not something you can just arbitrarily just decide to do. You will just put it down, and then your blood pressure goes up and causes bigger problems. So how do you approach that?
So I'm also board certified in lifestyle medicine in addition to internal medicine. And so for improving chronic diseases, we do a lot of focus on nutrition counseling and physical activity, stress management, avoidance of risky substances, sleep, healthy relationships, those type of things that can be the underlying cause of a lot of the chronic diseases that we have in America. And so those things are usually somewhere in play that if we work on those, people's other problems will improve.
And I think a lot of us have gotten into that mindset that once a problem has arisen, like diabetes or high blood pressure, that's not really something you can do anything about. That's why we go to the doctor and we get medication for it to treat the symptom as opposed to the problem. Do you find that you can actually, in most cases, take care of that?
Rough estimate, like 80% of high blood pressure or diabetes are reversible if people make appropriate lifestyle modifications and get rid of some of the toxic food and environmental things that are very prominent in our society. A good portion of it is due to we are very sedentary. We didn't used to be. We are eating a lot of processed food that historically has only been around for like 30 or 40 years, and people are just chronically stressed. So if we can work on those things, your blood pressure comes down, your blood sugar stabilizes, and people get better.
So that's really surprising to me that many people could be able to get off of their medications if they were able to make the lifestyle changes that you talk about. And so you really break down what it is that's causing those problems and try to help people formulate a plan to be able to get past that.
In my first visit, I'm asking people, so what did you eat in the last 24 hours, just to get like a rough idea of their usual eating patterns. How's your sleep? Do you exercise? Do you smoke? Do you do any type of recreational drugs? What's your alcohol intake like? So all of those things are part of your initial visit to give me an idea of what are some areas you could improve in.
Well, and you talk about those longer visits, and that seems like it would give you time to actually explore the different portions of people's life as opposed to the one symptom. And I really like that. It's one of the things that just really, when you told me that you do 30 to 60-minute visits on a typical visit, as opposed to those really short visits that you get where you spend more time in the waiting room than you do with the doctor, that really surprised me. And then we talk about how this works, where you're able to actually get to know your patients, talk about their underlying health issues, the food that they're eating, the activities that they're engaged in, and really get to understand how you can improve that. When you look at the traditional model, I've seen so many problems with it where they want to throw medicine at you or they want to just get you out of the office as quickly as possible. And they're not really listening to all of your problems. And one of the things you talked about is really getting to that holistic approach, understanding everything that's going on as opposed to just those couple of symptoms that you have the time for it in that short interview with the doctor, which is just not enough time.
Mm-hmm.
So tell me a little bit about your practice. How long have you been in business now?
So we opened in January 2025. The concept has been around for over a decade or so. And I learned about it a couple years ago and thought, oh, one day it'll be nice to do that. And one day was super far off in my mind at that time. And then the more I worked in the corporate structure, one day kept getting closer and closer.
Tell us a little bit about your experience before starting your own practice.
I worked at a community health center immediately after residency. I worked there for 4 years, and then I worked for one of the major systems in Charlotte for 4 years before deciding to strike out on my own.
So 8 years of experience in the traditional structure, so plenty of experience in the medical field. And I know that the schooling for that is quite rigorous.
Mm-hmm.
But what about being a business owner? Now you own your own practice. You are the beginning and the end of everything that happens
Mm-hmm.
here. How much of a challenge has that been for you?
It's a big learning curve. I've been doing a lot of marketing and networking that I never had to do before, because in the traditional structure, when you're on people's insurance plans, they kind of just show up on your schedule. The doctors don't actually have to do anything. You don't have to sell yourself at all. Now I am going out, explaining the practice to people, and actively working on bringing patients into the practice, because if you Google primary care, then the big systems are what's going to come up on the internet. So it just takes a bit more effort when you're a solo practitioner.
When you are advertising yourself and you're talking about the different parts of your business, what do you find to be the biggest challenge?
People associate healthcare with insurance. And insurance is not necessarily healthcare, it's just a payment model. And so just because you have insurance doesn't mean you have good healthcare or quality healthcare. It just means that they're going to help you cover some of your bills. And really and truly, most insurance companies are denying more and more, and it's getting more and more expensive. So what they're covering isn't what people expect.
It's always been my opinion that insurance has been a big part of the problem. It started out as a great way to try to help with some of the catastrophic care where it just gets so expensive and you really need it. to start covering everything. And as they've covered everything, it seemed like the service that we get has been lessened over time. So it's really interesting to see, kind of going back where it's just you and your doctor, the insurance keeping them out of that basic care. And then, you talked about still being able to use them for the services outside of your office, which can be more expensive and important in that catastrophic care. So what about with your service, do you think is going to be the most beneficial for people?
I think the access is most beneficial for people. So when something is bothering you, actually being able to either get a same day or next day visit or text or call your doctor directly is very beneficial, as opposed to saying, oh, my doctor can't see me for 2 or 3 weeks and this problem just came up. So I guess I'll go to the emergency room and wait in there for 8 hours. Or, oh, I have a question about this. Let me write it down. And when I see my doctor in 3 months, then I'll ask them, as opposed to, let me just text the question real quick. If she needs to see me, she'll have me come in. If she doesn't, then she can answer my question via text.
So you actually accept text messages if you have small questions?
Yes, so I have a patient only phone number. So after people sign up, they get a little card with the patient only access number and they can text me anytime. If it's something urgent, I might respond. I usually will respond after hours, within a couple of hours. If it is something, and if it's a life-threatening emergency, they need to go to the hospital. But other than that, I'll respond within hours or the next business day.
Well, that's definitely different. I think most people have had something come up, and it seems fairly minor. And so, what do? We call a trusted family member, a parent,
Google.
or check Google, and those answers aren't always the best. They don't have the experience that you have. They don't have the technical knowledge. So they can always just reach out to you to answer those questions. And if it ends up being something more serious, just schedule an appointment. I think that's fantastic to be able to have that flexibility. Like I said, when we first met, I had never heard of this model, and I thought that was a really interesting thing. So I did some research, and some of the things that I came across were just mind blowing for me. I looked and I saw that your traditional doctors have over 2,000 patients, and I think about trying to keep track of my daily life, but now trying to keep track of over 2,000 people, all of their medical problems, whatever they're going through. It's no wonder when we go in and talk to our doctor, they don't really know what's going on. So tell me a little bit about how that differs for you, because I understand it's not the same.
In the direct primary care model, a doctor will generally have 300 to 600 patients, so they can maintain that open access that I was speaking of with the same day, next day visits and the longer appointments. Because we are cutting out the insurance middleman, we kind of regulate our own patient panel size to be whatever allows us to maintain good quality access and customer service.
And for you, when you're getting started, you said this was a new adventure and it was a new model for you. How did you learn about the direct primary care and how to implement it, and what's already being done in other places?
Originally, I learned about it via a newspaper article that my mom had sent me, and I was like, that's random. And then I started seeing it on the internet more and more. When I decided that that was the way that I wanted to go, I went to 2 different conferences in 2024. I went to conferences to meet other people with more experience and just learn more about like the step-by-step how to set up a practice type things. And then a lot of it has been, internet research and reaching out to other physicians who are either in the area or who I know in other cities.
Well, what is it that you think has been, or who have you been able to reach out and connect with that has been most helpful for you at getting started?
A couple of things. My mom actually sees a direct primary care doctor, so I've been able to speak with her and ask questions. There are a couple other more experienced people who've been in the area for a long time, and I've spoken with most of them. I'm in a group chat on WhatsApp with people that I met at one of the conferences last year, so we've been able to bounce ideas off of each other and also, tell each other like what's working, what's not working. I'm using this system for this. What are you using for that? And so that's been very helpful to see like what other people are doing and also get ideas for things.
As you reach out to those other people, I'm sure it's nice to have somebody to bounce ideas off of.
Yeah. It's a very supportive community of physicians. Most people are a lot happier not working in the corporate model where you're seeing 20 to 25 people a day. And so they're very willing to help and answer questions.
One of the things that we focus on Bishop's Gambit is the Charlotte area. And so we're really interested in your take on how it's been about being in Charlotte. Has that been something that you found to be beneficial? And what about the community do you like or dislike?
I like Charlotte because there's always something going on. I've lived here for 4 years now, plus another year back in 2009. And so I've seen it grow and change, and neighborhoods are evolving. And so there's just always something new and different. You have access to a lot of things in terms of activities, restaurants, concerts, outdoor, naturey type stuff. So I think it's a great city to live in. And I think with the number of people who are moving here, every day I think something like 100 people are moving to Charlotte. So that's, ripe opportunity for direct primary care to fill a space.
Absolutely. And Charlotte definitely is unique. It's got its own community, its ins and outs. And like you talk about with that growth, there's so much diversity. It's really interesting the way Charlotte has come up. The other thing that we like to focus on is business, and how does it to run a business? What do you think being successful is, not just as a doctor, but as any business owner? What do you think that means to you?
So being successful means serving the community that is your target community, whichever one that may be, and providing good service that makes people happy and fulfilled and satisfied, so that they keep coming back, and being able to keep your doors open and pay your staff. I think all of that counts towards success.
And do you find Charlotte to be business friendly? Have you found any, you talked about your chat groups and things like that. Have you found Charlotte to have business resources that are helpful?
So, what I learned in February is that Charlotte has 9 million networking groups.
Wow.
Not literally 9 million, but there are so many. There's definitely opportunity if you're interested in that to be everywhere talking to everybody all the time. And a lot of people are very friendly in the groups. I probably went to at least 10, 15 networking groups in the last few months and met like different people. Now, sometimes you run into the same people depending on the event. It's always been a very friendly and encouraging environment.
Well, that's excellent that you found Charlotte to be welcoming and helpful in your growth. And as we look forward to the future, what are your goals as you're just getting started? So what are your goals, maybe in 3 to 5 years?
3 to 5 years. So by 3 to 5 years from now, I will hope that my personal panel is full, and then I've been able to hire another doctor to expand the number of patients the practice can take. And then I would also like to be having medical students again, because I previously have had med students rotate with me. So I would like them to see a different type of primary care to encourage more students to go into primary care, because many people may not know, but if you are a med student and you say you want to go into primary care, there's a lot of people that are like, why would you do that? They're so stressed out. They don't make any money. You're not going to be able to pay your student loan. I would like to show them that there are good, viable options for a long career in primary care.
Well, how do you respond to those critiques of the primary physician?
Some people's definition of not making any money comes from a place of privilege, because no matter what, if you're a doctor, you're making more than most of the population, unless you're working for free or doing Doctors Without Borders or something like that. So any money is very subjective. However, primary care, pediatrics, internal medicine, family medicine are on the lowest end of the spectrum in terms of the realm of doctors. Like the surgeons are and the dermatologists are making like 4 or 5 times what we make. And so I can see how that would be their perspective. However, you can still live a good life with primary care.
So why is it, with all that critique, that you decided that the primary care was where you wanted to go as opposed to those high end?
I rotated with several primary care doctors that kind of nurtured that love for me of developing relationships with patients and seeing them long term, and taking care of people in a way that you can see their progress over time, as opposed to these really quick visits and you maybe will never see them again because you were only there to fix their knee or their hip or whatever.
Well, then it sounds like not only the primary physician, but the specific model you've now gone into is more along the lines of what you wanted anyway, to be able to gather those real relationships with people that you know them when they come in, as opposed to just another face So what do you see as trends in the medical field? I mean, this right here, you said it's been around for 10 years, so it's still fairly new. But what other trends and things do you see happening in the medical field that you're excited about?
I think more people are getting invested in their health and thinking, okay, I don't want to, be on a bunch of medications. I don't want to be disabled in my 60s because, 50, okay, let me see, what's the number? 60% of of adults in America over the age of 50 have at least one chronic disease. And a lot of people are trying to get away from that. And so that puts more interest in being proactive about your health. And I'm meeting people who are just like, oh, yeah, because I want to do this, or, I want to play with my grandkids, or some people in their 40s are like, I have toddlers and I need to stay in shape for them. And so there's just a trend towards people being more prevention focused.
Well, that's great news. I think the country, as we look at the health statistics around the country, is in a really bad place.
Terrible.
And so it's good to see that the trend is kind of changing on that, so that maybe we can get more healthy as a country.
I will say there might be a little bit of selection bias of just people who are attracted to my type of practice being the people who are interested in those type of things. So there still needs to be more education and more public health changes and outreach to help get everybody on board. But hopefully we're heading in the right direction.
Well, hopefully with more people like you coming around and trying alternatives to be able to help people be more healthy, we can really get everybody more interested in that as you talk about. Well, Dr. Long, this has been a great experience. I've really appreciated getting to know you and about your business. Well, that's it for us today. But the culture, the hustle, the flavor of Charlotte, that's still cooking. If you've got a story, we want to hear it. Join us next time on Bishop's Gambit.